While HIV may not be in the headlines as often as it once was, it remains a very serious public health issue in many communities, including in Newark. St. Michael's Medical Center is bringing healthcare directly into the community with a new mobile medical unit to provide HIV testing and prevention where people live and work. Dr. Alan Sickles is the CEO of St. Michael's Medical Center, and Dr. Jihad Slim is an infectious disease specialist at the hospital. We say good morning to both of you.
Good
Good
morning,
morning.
Ken.
Well, doctors, the nowadays with all the different prophylactic drugs that people can take who are sexually active, gay or straight, it almost seems like it should never happen that people are coming down, getting infected with HIV. Plus, just the idea of education and teaching people to have safer sex. But you are doing something very real. You're going out in the community with this new mobile medical unit focusing on HIV services. So, what inspired the hospital to launch the initiative? Let's start with you, Dr. Sickles.
So we have a long history of caring for patients with HIV here at St. Michael's. The Peter Ho Clinic is one of the first and largest HIV treatment programs in New Jersey. And we've always been very dedicated to getting out into the community. And we recently purchased a new mobile van that's going to allow us to do that with greater efficiency, be out there more often. It's really a mobile office. It's pretty great.
Again, we talk about you have injections that last for months, like Apretude. You have Descovy, which is a daily pill, and these things have enormous success rates at preventing HIV. I know they're not cheap; they're very expensive. What is the barrier, would you say? And well, this is for Dr. Sickles again. What is the barrier, do you think, for many people in just doing that as a prophylactic, as a preventive? Is it because of the expense or lack of education, would you say? What do you think?
I think you raised two really good points. I think one is just a lack of education, a lack of understanding, and the other is the expense. These drugs are expensive, and if you're taking the oral medications that have to be taken every day, fortunately, with the newer injectables, they can be given once every couple of weeks, every couple of months, and we're hoping to get greater compliance.
Yeah, because as long as people comply and take that medication, HIV, which when I was younger, and I'm sure you remember the era, HIV was a
Sure.
death sentence. Today, it's a manageable condition, and for most, I know in certain circumstances it's not so much, but for most people, and it's something that I think more people need to learn that in order to realize that we could basically eradicate it. But it takes cooperation and takes education. Dr. Slim, even though HIV isn't discussed as much in the media today, it's still very prevalent in Newark. So, what is the current situation looking like in the city of Newark?
Well, the city of Newark is still unfortunately one of the cities with the highest incidence in the U.S. and there is a lot of difficulty for people to access care and education, as you guys were mentioning earlier. So a big need for education, a big need to reach out for people and to get rid of the stigma, which Peter Ho Medical Clinic has done a great job changing from an HIV clinic to an HIV status neutral, where everybody that is sexually active are or at risk for HIV are welcome. If they test positive, they get treated right away and taken care of. And if they're HIV negative, then we try to put them on what you mentioned is PrEP, or at least counsel them about PrEP. And current PrEP is up to every 6 months injections, right, for prevention. And going in the future, we're going to have once a year probably injection. So PrEP is great, but if nobody knows about it and if they don't come to get it, then it won't help anybody. And Newark is one of those cities that will need a lot of help to get everybody on track.
And a reminder to people who are sexually active that PrEP is not an excuse not to use other things like condoms, et cetera, because there are still other communicable diseases you can get. PrEP will prevent greatly reduce the chance of you getting HIV, but you could still get about a dozen other things. So you want to make sure that you are responsible and do this as safely as possible. We're not saying don't have sex. We're saying do it responsibly. So now this mobile unit, Dr. Sickles, represents a big investment. But yet, that's the commitment the hospital has to the community. What services will it provide overall when it's out there? Is it going to be giving the education as well as the treatment?
Yes, I think you can. If you think of it as really a mobile office, it's much more of a van. When you step inside, it really does have the feel of an office. It's connected to our electronic medical record. It's got an exam room. It's got a little administrative area. And we'll use this in conjunction with our educational programs to bring HIV testing and education to the patients where they are, to bring it out into the community.
Dr. Slim, I'll ask you this. Do you find that it's younger people today who are not alerted to how easy it is to get HIV and how it doesn't have to be? Is it because I remember 25 and 30 years ago, we drilled the message home. Today, we just don't do it as much in media. Is that the cause?
Yeah, well, you're absolutely right, Ken. So there is a measure that we use in HIV elimination programs is called PrEP to need ratio, the number of people on PrEP in a population over the number of people who are newly infected. And that PrEP to need ratio is the lowest in the young population in Newark. It's almost around 9, when nationwide it's around 14. So we're
Wow.
definitely below that. So kids need more education and help with getting on PrEP, at least, to prevent
Right.
new infections.
Because infection can be zero. It can be zero, and that's
Yeah.
the goal, right? It's just a
Yeah.
matter of following. We already know how to get there. It's just a matter of following the path. Dr. Sickles, what's a website for people to get more information to find out where the van's going to go?
www.smmc.com, St. Michael's Medical Center.
Awesome. You're doing yeoman's work, both of you, and your entire team. Dr. Alan Sickles, CEO of St. Michael's Medical Center, Dr. Jihad Slim, infectious disease specialist at the hospital. Thank you both for coming on this morning and for helping the community like you do all the time. We appreciate it.
Thanks for spreading the word, Ken. Appreciate it.
You bet.
Thanks, man.
Come back anytime, anytime. We appreciate you both.